Welcome to Chapter 4, Carbohydrate, Sugar, Starch, Glycogen, and Fiber. Diabetes Part 1 by Professor Tammy. Learning Objectives. Briefly summarize the differences among type 1 diabetes and type 2 diabetes. Itemize the effects of added sugars on health.
Diabetes. It used to be the leading cause of death in the U.S. Prediabetes is a fasting plasma glucose test. And you can take the HbA1c test, which is different from the usual blood glucose test, which kind of calculates what your blood glucose level is at that moment, versus the HbA1c is a test that kind of averages out what your glucose level was between 2 to 3 months. Common forms of diabetes, which we will talk about. Dangers of diabetes, toxic effects of excess glucose, inflammation, especially of your organs, circulation problems. Diabetes complication can be with the brain, eye damage, oral health, heart disease, stomach, kidney damage, sexual dysfunction, nerve damage, and foot damage. Diabetes is the inability to regulate blood glucose levels. Hyperglycemia, in which glucose levels are higher than normal, becomes chronic. So hyperglycemia is high, glycemia is glucose, high glucose. Prediabetes, 84 million people, that's 1 in 3 people in the U.S. in 1995. So 90% do not know they have prediabetes. So it's important to get your checkup, your annual checkup. There are 3 types of diabetes. Type 1, which is used to be known as the child onset diabetes. About 5 to 10% of the people have this. Type 2 diabetes used to be called adult onset diabetes, which about 90 to 90% of adults have this. Gestational diabetes is when you're pregnant, and about 2% of the people have this. Uncontrollable diabetes can cause infections, nerve damage, kidney damage, blindness, seizures, stroke, and cardiovascular disease, and it can be fatal. You can die from it, especially if you don't take care of yourself. So when you look at the charts to the right, about 7.9% of Caucasians have type 2 diabetes, 8.9% Asian Americans, 12.2% Hispanic Latinos, 13.1% North African American, and 17.9% American Indians and Native Alaskans, or Alaskan Natives. Type 1 and Type 2 diabetes, how do we compare them? As far as percentage of cases, Type 1 have about 5 to 10% of those who have diabetes. Type 2 is about 90 to 95% of those with diabetes. Age of onset. Type 1, you usually started before 30 years old. Type 2 is usually after 45 years old. But don't let that deceive you, because some children, even about 10-15 years ago, were starting to have diabetes when they were either teenagers or preteens. Associated characteristic. Type 1 is an autoimmune disease. Could be a viral infection or because of family genetic history. Type 2 is because of aging, overweight, or obesity family history, heart disease, elevated blood lipids, hypertension, psychological depression, or some medication. Primary problems with type 1 is the destruction of pancreatic beta cells, which they become insulin deficiency. So what that means is those with type 1 diabetes really need to take their insulin shots or pills. Type 2 diabetes, it varies. Some people don't need to take insulin shots or pills because their diabetes is not that bad and they're taking charge of it and they can still live a normal life, but they still have to kind of just be aware of the carbohydrate consumption that they have. Require insulin. Type 1 always requires insulin because their pancreas is not producing insulin, so they need it always. Type 2, they may or may not need it depending if they, how bad their diabetes are, as in is insulin being produced in their pancreas or not too, and they have them been controlling their diabetes. Older names. Type 1 used to be called the juvenile onset diabetes, insulin dependent diabetes mellitus. Type 2 used to be called adult onset diabetes, non-insulin dependent diabetes mellitus. Symptoms of type 1 and type 2 diabetes. Type 1, increased or frequent urination, so you're always going to the bathroom. Excess thirst, you're thirsty. You're also hungry a lot, and also think you have weight loss, or you feel very tired. And a lot of times you feel tired because the glucose is not getting to your cell to recharge you, and also blurred vision. Type 2, any of the type 1 signs and symptoms, and also type 2 have a greater frequency of infection. Also sudden vision changes, slow healing wounds or sores, tingling of numbness in the hands or feet, and very dry skin. Diabetes 1. Type 1 diabetes. In the past it was called childhood onset diabetes, and that was about 10 to 20 years ago. Type 1 accounts for about 5 to 10% of all cases, all diabetic cases. Usually when this occurs is when someone is young. The body does not produce enough insulin. It creates high blood sugar, high blood glucose levels. The key warning is when you frequently go to the bathroom and urinate. This may also lead to ketoacidosis, coma, and death. It's classified as an autoimmune disease. Most frequently diagnosed in adolescence. It has a genetic link, or it can also be an autoimmune disorder. Your own immune system attacks your pancreas, which causes it to lose the ability to produce insulin. So external sources of insulin, you can have a fast-acting or long-acting form, which can be in the form of pill or shots. Diabetes 2, type 2 diabetes, used to be called adult onset diabetes because it usually occurs in adults, but in more recent years, the last 15 years, we have noticed that children, teens, and preteens are starting to get this adult onset diabetes, so they changed the name to type 2 diabetes because it no longer applies to adults only. Type 2 is the predominant type of diabetes. It's the diabetes that most people get. It's about 90 to 95% of those with diabetes who have type 2 diabetes. It develops over a period of time. It doesn't just happen overnight. Obesity usually is the underlying case. Body cells become insensitive or unresponsive to insulin, and it loses the sensitivity to insulin. Eventually, the pancreas may become unable to produce any insulin, and that's when it produces less insulin, far less insulin, or not enough or not any. That's when you start having the insulin pills or shots. There's a variation of insulin-resistant, impaired fast glucose, and prediabetes. Obesity is the most common trigger, but it doesn't mean that someone who's within their BMI won't get type 2 diabetes. Middle age and physical inactivity is also a contribution to the diabetes too. Also the fat accumulation, mostly around the stomach area, not the thigh area. It's the stomach area, more like the apple shape. And it also can be genetic too. So even though you may have the genetic trait of having diabetes, you should take care of yourself. having diabetes may be unavoidable, but at least it can be delayed as long as possible. Instead of having it in your 20s, maybe having it in 50s or 60s. You don't want it early, you want it later if you were to have it. But it's really important to continue being physically active too. Preventing type 2 diabetes, maintaining healthy body weight, nutritious eating pattern, moderate in calories, low in saturated fat, high in vegetables, legume, fruit, fish, poultry, and whole grains, and need to regularly exercise or be physically active. So, diabetes is a chronic disease in which the body can no longer regulate glucose within normal limits, and blood glucose becomes dangerously high. So here, when you look at it, normal glucose level, the liver releases a glucose into the bloodstream. Pancreas releases insulin. They're both in the bloodstream. Pancreas says insulin uses, it's kind of opens the door for the glucose. It's like a glucose transporter. So the insulin stimulates glucose transporters within cells to travel to the cell membrane and prompt the uptake of glucose into cells. So think of it like a key for glucose to enter the cells. So as glucose is taken into the interior of cells, less glucose remains in the bloodstream. For type 1 diabetes, same thing. Glucose from the liver is released to the bloodstream. The pancreas is damaged, destroyed, has little or no insulin to release into the bloodstream. So when that happens, there's an absence of insulin. So can they get into the cell? No. That's why there's a high level of glucose that's in the bloodstream. Type 2 diabetes. Liver releases glucose into the bloodstream. Pancreas releases insulin, so there is some insulin, but it doesn't work efficiently because it's not really opening the door for the glucose to enter into the cells. So insulin is present, but cells fail to respond adequately. Progressively higher amounts of insulin must be produced by the pancreas to stimulate cells to uptake glucose. So that continues with the high levels of glucose that remains in the bloodstream. Diabetes, who is at risk? Those with obesity, genetics of diabetes, physically inactive, poor diet increase over overall risk. That means it's not just one day, it's like over a long period of time. Metabolic syndrome, high waist circumference. That means your waist is kind of bigger. High blood pressure, high blood lipids and glucose, increased risk of type 2 diabetes. Increased age increases risk, but younger people, even children, now commonly getting diagnosed with diabetes. Diabetes prevention and control. So what to do? Eat a healthful diet, get daily exercise, keep a healthful body weight, limit intake of added sugars, choose fiber-rich foods like whole grains, limit consumption of red meat and processed meat, avoid alcoholic beverages which can cause hyperglycemia. Healthful lifestyle choices can prevent or delay onset of type 2 diabetes, or medication or insulin injections can be required once diabetes has been diagnosed. But some people don't really need the injection or the oral medication even for a long time if they learn how to control their diabetes so it won't go out of control. So I want you to also watch this video. This is such a good video. It'll help you understand how diabetes affects your blood sugar. So
see you soon. And remember to read the book.